Welcome to today's press briefing. With us today Dr. Chong Shuk Kwan, Head of Communicable Disease Branch, CHP, and Dr. Gladys Kwan, Chief Manager, Hospital Authority. Dr. Chuang, please. We have 199 PCR positive cases, 21 from the HA, 19 from the CHP, and 153 from the private labs. And 300 cases of RAT positive cases. Total number is 499 cases today. Cumulatively, we have 1,201,561 cases of positive cases, 750,077 PCR positives, and 451,484 RAT positives. On May 31st, of the RAT positive cases, we have double-checked them. 49 cases, or 23%, retested to be negative. And of today's figures, there are 49 imported cases, 43 PCR positives, and 7 RAT positives. 25 cases. 24 of them were picked up at the airport, 20 arriving on June 2nd by the 13 flights, and there are four flights, and there are 14 cases that were picked up at the quarantine hotels from days 2 and 5, and there is a case who is a local pilot, picked up on day 3 on RAT, arriving in Hong Kong on May 31st, and this will be taken to genome sequences to identify whether it is foreign or local. And there are cases from day 10, there are cases from day 8. And these are people who meant to leave Hong Kong for the mainland, and they underwent a PCR test, and the PCR test came back positive. So some with high CT value, over 30. It seems that they are re-positive cases. Some are indeterminate. There are 2 cases picked up from day 9, and also one from day 10. And these are previously confirmed cases with high CT value. There is a case with a CT value which is low, 26, 27 or thereabout. This case has some activities locally. It seems like a local case. Now, these cases will be sent to genome sequencing test and see whether these are local cases or whether they are re-positive cases. For care homes, there is one staff member from a care home, a carer, in fact, who has tested positive, and the family member also tested positive earlier. And there are 9 close contacts from the care home who have to be sent to quarantine. And there were no previous cases from this center. The last one was in mid-April. In terms of schools, yesterday afternoon, there are 12 cases reported from 11 schools, 9 students and 3 staff members. 11 RAT positive, 1 PCR positive. For the 9 students, they come from 4 kindergartens, 2 primary and 2 secondary schools. 3 staff members come from 2 primary and 1 kindergarten. Yesterday we mentioned the 8 schools with 2 cases or more. One of these schools has 2 pupils who are kindergarten pupils attending Hong Kong Christian kindergarten, and this is a whole day kindergarten, there is an afternoon nap time between 12:45 and 2:45. They didn't wear any face masks at that time. The two kids were sleeping side by side, and both of them tested positive. Our initial sequencing analysis are suspected to be BA.2.12.1. And in the room, there were other kids who were catching a siesta there as well. They also have been sent to a quarantine. And for the DSC International School, there is one more case coming from the same class, last day at school, May 25th. And in that class, Emily remains suspended until June 5th. And the family members of a household of 4, they're all confirmed cases. They are suspected to be BA.2.12.1. Death cases, the HA reported 2 more death cases, and the total number is 9,168. That's the death numbers for the 5th wave. As to the suspected BA.2.12.1 case, I mentioned the 2 suspected cases from the kindergarten, and also there are 6 suspected, or 4 suspected cases from DSC International. And there is one case for which we haven't quite figured out the source, and the case family members also positive cases living at Zhonghao Street, number 66 in Kowloon. Central Club and Iron Ferry Spa, there are no new cases arising for today. Yesterday we mentioned the LINQ bar at Pottinger Street. There are 3 additional cases, taking the total to 23. For the 3 new cases, they turn up there on the 28th of May. So there are 13 cases on May 28th, 10 on May 27th. We know that on May the 27th, there were 150 or 150 patrons entering the bar. We are still checking the numbers. There might be some duplication. On May the 28th, there were about 200 patrons turning up at the bar. When we conducted the investigation on site, we collected some environmental samples, 32 samples from the toilets, from the table service, and the purifier. All of them tested negative. Other than this bar, there is another one at Lan Kwai Fong called Shuffle, SUFFIL, on May 28th at 11:30 to 2 a.m. We found 14 cases. One of the cases a week earlier went to the Central Bar. There are 11 females, 3 males, ranging in age between 21 and 32. And on May 30th and 31st, they started developing some discomfort, and then they tested positive. This afternoon, we have sent some colleagues down there to have a look at the environment, and we will be looking at the vaccine pass to follow up. So much I have to report. Thank you.
Over to Dr. Gladys Kwan, who will tell us about the situation on the side of the hospital authority. 362 patients are staying at hospitals. 331 are new COVID patients. Those requiring isolation, 70 are staying at isolation ward, 12 in Tier 2 isolation ward, 31 are at the Northlander Hospital Hong Kong Infection Control Center. In total, 16 are new COVID patients. Yesterday, there was no report of patients in a critical or in a serious condition. Among those being hospitalized, 12 are in a critical condition, 7 in a serious condition. 6 critical patients are currently under intensive care. Among the cases yesterday, there were 2 patients who passed away. Both were males aged 79 and 87. They're not from care homes. The 87-year-old male had hypertension, chronic kidney condition, heart disease, and lung cancer. He had 1 jab, and due to breathing difficulties and cough, on 28th of May, he was hospitalized. His PCR result was positive with a high CT value at 37.4. Due to his own health conditions and led to complications in the lung cancer, he passed away on June 2nd. The 79-year-old was double jabbed. He had hypertension, chronic bronchitis, and also kidney condition. On May 27, he had a headache and vomited. The CT scan revealed hemorrhage. He was sent to the ICU. Upon admission, he tested PCR positive with a CT value at 36. His condition worsened. Yesterday afternoon, he passed away. Yesterday, 59 patients recovered. 47 have been discharged. In the 5th wave of outbreak to date, 50,410 patients have recovered. 50,057 patients have been discharged. Starting from early 2022, 62,791 patients have recovered. 62,437 have been discharged. 1 patient tested positive upon hospital admission screening. 2 patients in the same ward are classified as close contacts. Among HA staff members, 23,457 members have been infected. 23,367 have returned to work. That's all from me. The floor is now open to questions. Please put up your hand and use a microphone our staff will pass you. Before putting your questions, please tell us your media outlet. We'll start with the lady in red. I'm from News. The first question, there are a few bars involved. Roughly 100 people are infected. What measures will the authorities take to bring the outbreak under control? Over the infection seen over the past few days, is there a sign of a rebound? What's the assessment of the authorities about the situation and what will be done? People are concerned about the COVID situation and also whether the social distancing rules will be tightened again. The COVID situation now, there may be a slight rise in the daily caseload, but whether it's a rebound, we'll still have to monitor the situation before we can tell. Some positive cases are returned through PCR tests. Others are reported after rapid antigen tests. And it depends on whether people go get tested and whether they report the result. For some cases, we believe that people are asymptomatic and they will not become aware of the infection until they get tested. Without a test, they wouldn't find out. So do the figures really signify the actual situation? We will have to look at other figures as well, such as those from the sewage surveillance scheme, and also the results from the restriction testing declarations and also hospitalization figures, as well as the severity of infections. But we do attach greater weight to the severe cases and the death cases, because these cases have a bearing. And these are things we're more concerned about. For those with the milder forms of infection, the figures now may not fully reflect the picture. So these things will be something we will have to keep monitoring. The next question, the lady in the vest at the back. I'm from Hong Kong 01. A question about the kindergarten. In terms of the source of infection, this involves BA.2.12.1. How did this subvariant enter the kindergarten? And for the environment, how many people are involved? How big is the area? How did the transmission happen? I want to clarify another point. The bar, LINK, how many people are infected at the bar? Yesterday you mentioned that 2 customers visited the bar on both nights. Yesterday you told us there were 18 customers. Today there are 3 new additional cases. So how many people are involved in total? Is it 23 or 21? Yesterday, among those on the compulsory testing notice, 2 restaurants are involved. One is in Central on Wellington Street called Cafe Crepe. There's another restaurant in Admiralty at Pacific Place called Triple O's. For these 2 restaurants, they're on the CTN. Is it because there are outbreaks there? Are cases identified there? People are still visiting these 2 restaurants. They may not be aware that they have to go get tested. What's the response from the doctors? Can you tell us more about the situation at these 2 restaurants? For the bar, LINQ, there were 23 visits, but the number of people involved is 21 because the 2 people visited the bar on both nights. Now for the kindergarten, 2 students in the same class are infected. We looked into the situation, and during the siesta, they were sleeping close to one another. They engaged in other activities, but the other activities are less likely to be the source of the transmission. The transmission may have happened during the siesta. For the entire room, there were 8 people. There were boards separating the students. As a precaution, we've asked the other children to undergo home isolation. And for these 2 cases, they're suspected carriers of a BA.2.12.1 subvariant. So they will be sent to isolation facilities together with their family members. The cause of the transmission, this is something that will take further investigation in the community. There may be silent transmission going on. We have to examine for the further factors involved. There are other Omicron subvariants involving the BA.2.12.1 subvariants. There may be silent transmission involving different subvariants. You mentioned 2 restaurants, as far as I can recall. There are some cases involving the BA.2.12.1 subvariant. People carriers visited different restaurants, but it may involve just isolated cases, so we're just putting them on the compulsory testing notice. The lady at the back. I'm from TVB. First question, the bar shuffle. How many patrons were there? At around the same time, was there dancing? Did people take off their masks? Was there any disc jockey playing music? In the area around Lan Kwai Fong or Central in general, are transmission chains identified? Will the scope of compulsory testing be expanded so that even pubs and bars without an outbreak will be subject to compulsory testing in covering all the people and businesses? Now, some cases, the RT cases, roughly 50 are found to be negative. What do you think is the reason for so many negative results after the confirmatory test? Is it a false declaration or other factors? Last night in Sham Shui Po, around 4 a.m., some bars were still operating. Has the CHP found that more bars are flouting the rules about their operation since the relaxation of the rules? Going forward, will there be a retightening of the requirements? Will people be reminded about the transmission risks?
As regards shuffle, we are still conducting the investigation. According to some of the patrons, they do have a dance area after the bar area. There is a dancing area as well, and many of them will be drinking and chatting, and some were dancing without their masks on. As to the precise number on that night, I think we have to look at the vaccine pass information before we are clear about the picture. We would target at the areas where there is an outbreak before we would impose compulsory testing. But if people have been to some high-risk places and if they feel unwell, they should undergo testing, whether it be RAT or PCR. Now, for the outbreaks they were identified, they've also undergone testing themselves. As to the RAT positive cases, we would investigate the situation. There may be situations where the RAT produces false positive. That might happen, or some of them may submit false information, or they may have submitted some outdated test results to us. We will follow up on them one by one. As to the Shui-Po case, I am not too acquainted with that. Now, if people are engaging in drinking, chatting, dining without any mask on, they should have been inoculated before they visit these places, because there is always a risk of infection. If one is infected without any vaccination, the chances of severe cases of death would be that much higher. A lady in short sleeve shirt. Now TV. If I may put a question about the LINQ. Yesterday was said that there is no dancing area, but after investigation, what is the configuration and layout of the tables? Are the infected people sitting close to one another? And when was the first case that was picked up? And Shuffle, the bar, you said that there was a case who's been to Zentral. When did the case go to Zentral before? Is this the index case? When was the onset time? There are some cases arising from the bars, and we know that the patrons will be spending pretty long time there, unmasked, and there is a high risk of exposure. What advice do you have for the bars and the patrons in this regard? And also for the schools, you mentioned a household of 4, family of 4, all testing positive, suspected to be 8.2, 12.1. Where did they live? And for the building that they reside in, did you have any previous cases of BA.2, 12.1? Right, in connection with LINQ, from our investigation, there doesn't seem to be any dance area. It's mainly a bar there, a bar table. People will be consuming drinks, walking about, chatting. There is a risk of infection from there. As to advice, our advice is that if you're not consuming any drink, if you're not drinking, you're just chatting, in particular if you're chatting with strangers, it's always safer to keep the mask on. But with the mask on, it doesn't necessarily mean that you will be free from any infection, because in other cases, like schools and so on, we've seen transmission taking place despite the mask being worn. As to the DSC International, there were some previous cases. You probably recall that. Bear with me. Now, for DSC International, there was an earlier case connected with the McDonald cluster. There were people from the McDonald cluster who at 10 school at DSC International, and this is one of the students who are from the same class. In that particular class, there were 8 students, including this person and the family members. And there is one additional one and the family member who have tested positive, and they're living in Sai Kung and Zhongguanou. And there were no previous suspected cases of BA.2, 12.1, but for the other cases in DSC International, they are suspected to be BA.2, 12.1, belonging to the same chain of transmission. Speaker not speaking through. We'll have to find out whether there is any connection. And these are one of the positive cases from the Central outbreak. The one at the back in red. Cable news. It was said that some people submitted false information to circumvent the vaccine pass, and there are 50 odd false positive cases. Are there any false, misrepresentation? How many of them have been referred to the police? And also the LINQ bar, Dr. Chuang, you said that there are 3 additional cases arising from this cluster. Are there a total of 21 positive cases from that bar? And have you undergone the whole genome sequencing yet? And is the index patient the one from Iron Ferries? And Central and Iron Ferries, are there any patients that have not yet undergone any tests? If so, why is it so difficult for you to track them down? Are you going to be enlisting the help of the police to track them down, or will you be prosecuting them? And also, the bar that suffered from outbreak lately, where is it? With so many outbreaks from bars, do you see the merits of closing the bars now? And yesterday, there was a case from Kai Chun Court, Kai Chun House. It is a male suffering from BA.2, 12.1. Have you identified the source? Is the genome sequencing result the same as the earlier cases? Well, yesterday we published the press release to say that there are 6 cases that submitted false information deliberately, and they have been referred to the police for follow-up action. Now, for suspected cases going forward, we will be making the same referral or the same. For LINQ, there are 3 additional cases, taking the number to 21 in total. There are 2 who've been there on 2 consecutive nights. On 27th, there are 10, and on 28th, there were 13. The number stands at 21. Central and Iron Ferries, the number is less than 100. There are less than 100 that have yet to undergo testing. We haven't found the record there. We have issued the warning, and there is a likelihood the legal action might be taken. Shuffle, it is Lan Kwai Fong, Decola Street, 38 to 44, Whole, a commercial building, ABG, shop ABG. And for the case of BA.2, 12.1 yesterday, we haven't identified the epidemiological link.
Speakers not coming through. The government is monitoring the situation, and there's no word on the bars having to shut. Next question, the lady over here.
So has the CHP run the genome sequencing of the infected patrons at LINQ bar? Is it similar to other bar clusters? How many RAT positive cases in total were required to do PCR follow-up tests? Is there an updated figure of how many of those cases were referred to the police for follow-up, and how many people were arrested? And the third question is, what's the name of the bar in Shamshui Po where the police arrested 250 people for breaching social distancing rules this morning? Thank you.
Actually, it takes a few more days for whole genome sequencing to be processed, but the previous two bars, they are, the whole genome sequencing is closely associated with locally circulating strain. So we need to do further tests to see whether the two new bars, the genetic sequencing. And we have issued, the government has issued a press release last night, and we have referred 6 cases to the police for follow-up, and 3 has been arrested. 3 of them have been arrested. And maybe you would like to ask the relevant government department, for example, the police, for the name of the bar in some circle.
Next question, the lady at the back. I'm from Mingpao. For the carriers of BA2121, the 2 students at the kindergarten, which district do they live in? Where do their family members work? For the other previous BA2121 do they have any contact with other BA2121 cases? Now, for the cases at Chonghao Street, how many people are infected in total? For the untraceable cases in Kowloon City, where do they work? Did they come into contact with other previous cases? For the local BA2121 cases, how many suspected and confirmed cases are there? What's the percentage they make up among all the local COVID cases? Does the CHP believe this subvariant has already spread out, and will there be an increase in such cases? Turning to bars, there was this case at the LINQ who has also been to Iron Ferries. Just to clarify, on which day and at what hours did this person visit the 2 bars? Is this already included among the Iron Ferries cases? Yesterday, you said that this person went to LINQ the week before. Does the CHP believe this person was already infected? When was this person's symptom onset? If this person was already infected during the visit to LINQ, do the people there have to undergo compulsory testing? At the place on Chonghao Street, 2 people are infected. One is a suspected carrier of the BA2121 subvariant. For the family members of the student, it's a place in Shaikong. These places are on the compulsory testing notice put out last night. As for the person who visited Iron Ferries, it's hard to tell. This person was asymptomatic at that time. If this person visited 2 bars and got infected at the first bar, it's not likely that this person started spreading the virus as soon as he or she visited the second bar. The speaker's not coming through. 21st, Saturday. If there's no other questions, that concludes the press briefing today. Thank you.